Imagine a role in healthcare. It needs the clinical skill of a nurse, the strategic mind of a business consultant, maybe the tech savvy of an AI specialist, and, get this, the diplomacy of a union negotiator.
That sounds like quite the combination.
It does, right? Sounds like a lot. Today we're doing a deep dive into the incredibly vital world of medical case management. We're looking particularly at how it's changing, evolving from the traditional RN role to really bring in AI-enhanced operations.
And we're drawing our insights from a really valuable resource here, Complete Guide to Medical Case Management, from RN to AI-enhanced operations. It's written by Claudia, who brings both business consulting and project management experience to the table.
Yeah, and what's striking, I think, is just how much ground this one guide covers. It really maps out the whole ecosystem a modern case manager has to navigate.
Exactly. So our mission for this deep dive is to pull out the most crucial bits, especially those maybe surprising facts you wouldn't necessarily expect in this field.
The goal is so you can quickly grasp what it really means to be a modern medical case manager.
Right.
Okay, so let's unpack this then. Our source gives us a pretty comprehensive roadmap. It goes from the very first day on the job all the way through navigating complex business stuff and even the unique challenges of managing in unionized environments.
Yeah, you'll definitely get a real sense of the diverse skills needed and just how pivotal this role has become.
So let's start at the core. What is medical case management, fundamentally?
Well, at its heart, it's described as a collaborative process. It's about assessing, planning, implementing, coordinating, monitoring, and evaluating services to meet someone's health needs.
Okay, the classic definition. Always aiming for quality, cost-effective outcomes. But what does that actually look like today? Because it feels like it's more than just that now.
Oh, definitely. If you think about the bigger picture, the case manager is really the crucial link. They connect patients, providers, and the whole healthcare system.
And technology is playing a bigger part.
A huge part. The integration of artificial intelligence, for instance, that's really transformed things. It's moving beyond just human-centered care to embrace, technology-driven efficiency.
How so? Like what kind of tech?
Things like predictive analytics, automated workflows. It allows for a more proactive and, frankly, efficient approach.
Okay, so if that's the big picture, what about day-to-day responsibilities? What's actually on their plate? It sounds like a massive list.
It absolutely is. And what's insightful from the guide is how these aren't just like separate tasks on a checklist. It's more of a dynamic interplay. Yeah, it reshapes the case manager into this kind of strategic coordinator. They're handling everything from direct patient assessment and care planning to navigating really complex resource allocation.
And quality assurance, risk mitigation.
Right. Ensuring quality, mitigating risks, and increasingly really diving deep into technology integration and optimization.
Wow.
The real challenge is orchestrating all of that simultaneously. Aiming for the best patient outcomes, but also system efficiency.
So that naturally leads to the question, what kind of person can actually handle all of that?
It's a good question. The book outlines a pretty impressive blend of skills and educational requirements. It usually starts with that RN foundation.
Meaning a nursing degree?
Typically a Bachelor of Science in Nursing, yeah.
Mm-hmm.
Plus a current RN license, and usually about 2-3 years of clinical experience.
Okay.
And certification like CCM, that's Certified Case Managers often preferred, sometimes required within the first year.
Right, the clinical basics. But here's where I think it gets really interesting, maybe unexpected for some. Beyond that clinical skill, advanced assessment, medication management, the modern case manager needs some serious tech skill.
Oh, absolutely. You're talking EHR proficiency.
Electronic health record systems, yeah.
Navigating specific case management software, integrating AI tools, being able to interpret data analytics, even managing telehealth platforms.
Yeah, it sounds like they need a tech degree on the side. It's like needing a roadmap and a compass just to keep up with the tools. It's a lot. And it doesn't stop there either. Business skills are also critical now.
Such as?
Things like project management methodologies, financial analysis, budgeting, understanding quality improvement processes, even basic contract negotiation.
Okay, so clinical, tech, and business skills.
And don't forget powerful communication skills. They're absolutely essential for patient advocacy, collaborating with interdisciplinary teams, resolving conflicts, and cultural competency is huge too.
It really is a skill kaleidoscope, as you said.
It truly is.
Now, the guide gets very practical. It provides this detailed, step-by-step roadmap for new case managers, right from day one through the first year.
Yeah, it's quite helpful.
So on the first day, it's pretty much what you'd expect, right?
Yeah.
Essential onboarding, checking in, getting system access, doing some initial assessments, maybe patient rounds, team introductions.
Information overload territory, basically.
Exactly. And the advice is simple. Prioritize and don't be afraid to ask for help because you'll need it. Absolutely. Then, moving into that first week, the focus shifts to building foundations and, crucially, relationships.
Okay.
So that means more comprehensive assessments, starting to develop initial care plans, shadowing experienced colleagues, which is super important, practicing documentation, learning who to call when things go wrong, escalation procedures.
And communication is key here.
The guide really hammers this home.
Yeah.
Consistent communication to build trust with patients and families, and proactive engagement with the whole healthcare team. You can't work in a silo.
Right. So, fast forward to the first month, what's the focus then?
By the first month, it's about establishing your workflows, optimizing your processes. You're trying to fine-tune that daily routine, maybe schedule weekly planning sessions.
Setting some goals.
Yeah, aiming for monthly objectives, like getting documentation compliance up to par, participating in quality improvement initiatives. This is really where mastering care coordination, both inside the hospital and outside, becomes critical.
And the tech piece comes back in.
Definitely. The guide points out specific ways AI tools start to play a role here. For example, using predictive analytics to flag patients who might be at higher risk.
Oh, interesting.
Or even leveraging automated care plan generation to, streamline those initial drafts. And just getting better at using the systems, like customizing your EHR views to be more efficient.
Got it. So, by the end of the first year, what's the expectation?
Mastery leadership development. That's the goal. So this means taking on more complex cases, mentoring newer staff members, maybe chairing committees, presenting at conferences even.
Stepping up.
Exactly. Contributing to policy development, strategic planning. It's about showing advanced competency in managing patients with multiple complex conditions, demonstrating technology leadership, perhaps overseeing an AI implementation pilot, and having sharp business acumen.
Like budget management.
Budget management, risk mitigation, absolutely. You're expected to be operating at a much higher, more strategic level by then.
Okay, so we've covered the clinical, the tech, the day-to-day learning curve, but you mentioned business acumen several times. It's clear this isn't just about patient care anymore. Let's explore that financial dimension. It seems like a really significant part of modern case management.
It really is. The source material covers cost management principles pretty thoroughly. Things like optimizing a patient's length of stay in the hospital, making sure they're at the appropriate level of care, not too high, not too low, and containing medication costs.
So it's a constant balancing act. Quality care versus cost effectiveness.
Precisely. And this is where financial analysis and reporting become key skills for the case manager.
What does that involve?
Evaluating the costs of interventions versus the outcomes achieved. Understanding revenue cycle management, basically, how the hospital gets paid. That includes dealing with insurance reimbursement, navigating those tricky prior authorizations.
It sounds less like nursing and more like finance sometimes.
Well, the guide even gets into value-based care models and departmental budgeting. So yeah, it's definitely a strategic financial role. It directly impacts the organization's bottom line. It's not just clinical work anymore.
Okay, and alongside the money, there's always compliance, right? You hear about HIPAA all the time, the Health Insurance Portability and Accountability Act.
Right, HIPAA. It might seem like just a buzzword to some, but for case managers, it's a daily reality. The guide details everything you need to know.
Like what?
Understanding protected health information, patient rights, the different types of safeguards, administrative, physical, technical. It's absolutely foundational for ensuring patient privacy and data security. You can't mess this up.
And it's not just IPA, is it?
No. Beyond IPA, there's compliance with other major players. Think the Joint Commission, which accredits healthcare organizations, or the CMS conditions of participation. Those are the rules if you want to build Medicare and Medicaid, plus various state and local regulations.
Wow, that's a lot to keep track of. How do case managers manage it all? That seems like a critical point the guide must address.
It does. Regular audits are essential. Having processes for corrective actions when something goes wrong, and just a strong ongoing focus on risk management. It's all about avoiding costly penalties and, most importantly, ensuring patient safety.
Which brings us back to communication. You mentioned it earlier, but it seems paramount, especially with all these different stakeholders.
Absolutely. Effective communication is critical, and it means tailoring your message depending on who you're talking to. Patients, families, the doctors and nurses on the team, external partners like home health agencies.
How do they do that? What tools?
It could involve using patient portals, secure messaging systems, maybe even video conferencing for family meetings. The key is always ensuring clarity and empathy, regardless of the medium.
And part of that communication is reporting upwards, right? To executives.
Yes. The ability to produce quality and performance reports is vital. That includes creating things like executive dashboards that highlight key performance indicators, KPI trends, and importantly, the financial impact of case management activities.
So if you're talking to executives, you need to speak their language.
Exactly. Engaging executives means understanding their priorities. What do they care about? Usually it's quality and safety metrics, financial performance, and strategic goals like population health initiatives or technology innovation.
So presenting to leadership isn't just dumping data.
Not at all. It's about crafting clear executive summaries, using data visualization, effectively charts and graphs, and really storytelling with data to show the impact you're making.
Being a change leader, essentially.
Precisely. Building support for initiatives, addressing resistance you might encounter, it's a leadership function.
And what about at the team level? How does that coordination work day to day?
Well, effective case management absolutely relies on well-coordinated interdisciplinary teams. Your core members are usually physicians, nurses, social workers. But you also have extended members, like physical therapists, occupational therapists, pharmacists, dietitians. The guide highlights the importance of things like daily huddles, formal interdisciplinary rounds, and those family meetings we mentioned as key coordination points to keep everyone on the same page.
Okay, now let's shift to something that honestly might surprise quite a few listeners. It's an area the guide apparently dedicates significant attention to. The unique challenges RN case managers face when they are actually managing unionized nurses.
Yes. That's often a real eye-opener for people outside of those specific environments. It's a whole different ballgame.
How so?
Because suddenly all your operational needs, staffing, scheduling, assignments have to be balanced against very specific, often rigid union contract requirements.
Can you give an example? The guide must get into specifics.
Oh, it does. One striking detail is the level of precision required. Take scheduling management, for instance. Case managers can't just create a schedule that works best operationally. They have to adhere strictly to contract parameters. Things like shift rotations, how overtime is distributed, preferences based on seniority. They usually need to provide advance notice for changes and meticulously document why decisions were made, specifically referencing the contract, to avoid grievances.
Grievances sound serious.
They can be very time-consuming and costly.
Right.
And it's not just scheduling. Think about HR issues like discipline.
Right.
It's not just about standard progressive discipline. You have to follow the exact procedures laid out in the union contract. These often mandate specific documentation steps, strict time frames, and almost always require the presence of a union representative during any disciplinary meeting.
So the contract is like a legal document governing everything.
Essentially, yes. Think of it as a meticulously detailed, legally binding blueprint for nearly every aspect of the manager-employee interaction. The grievance process itself usually has multiple formal steps, starting from informal resolution attempts right up to formal written grievances, reviews by higher management, and potentially binding arbitration, which can be very expensive.
Wow. So you mentioned precision. How precise does a case manager need to be when interpreting this blueprint, this contract?
Extremely precise. The exact contract language is absolutely key. Grievances often hinge on how specific terms are interpreted.
Like what kind of terms?
Things around scheduling. Does the contract say assignment should be fair and equitable or strictly by seniority? Those mean very different things. Assignment terms like patient to nurse ratios or rules about floating nurses to other units. Disciplinary language to what counts as a similar versus an unrelated infraction when you're applying progressive discipline. A single word or phrase can determine the outcome.
It really does sound like a minefield. What are some common pitfalls mentioned?
Absolutely. Ambiguous words in the contract, like reasonable or appropriate, can be tricky. They often get interpreted broadly in arbitration, usually favoring the nurse's position.
Okay.
Another big one is past practice. Sometimes the way things have always been done, even if it slightly contradicts the written contract, can create a binding precedent if management hasn't addressed it.
So history matters.
Very much so. And you have to watch out for cross-reference sections in the contract. Missing a related clause somewhere else in the document can completely invalidate your position on an issue.
Okay, this sounds incredibly complex. So what does this mean for actual practical management strategies? How do successful case managers navigate this?
Well, first and foremost, documentation, documentation, documentation. Maintaining detailed, objective records of all interactions, decisions, and the rationale behind them, often linking back to specific contract clauses.
Makes sense.
Understanding the specific contract language inside and out is essential. Some managers even create quick reference guides for key sections. And crucially, the most successful ones adopt a collaborative approach with union stewards.
Collaborative, not adversarial.
Ideally, yes. Building trust and maintaining open communication can prevent many issues from escalating into formal grievances in the first place. And consistency is vital. Applying policies and contract rules the same way across all staff prevents claims of discrimination or favoritism, which often fuel grievances.
So view the steward as a colleague.
The guide suggests the most successful managers do, just that they see stewards as valuable colleagues who can actually help identify potential problems early on. It also stresses consulting with HR or labor relations experts whenever there's uncertainty. Don't guess.
Are there common mistakes to avoid?
Definitely. Playing favorites, enforcing rules inconsistently, trying to exclude stewards from decisions where the contract requires their involvement, or simply having gaps in documentation, those are all recipes for trouble. The contract really is the law governing that workplace relationship, and knowing how to interpret it precisely often determines the outcome.
Fascinating. And the role extends even beyond that, doesn't it, to crises?
Yes, the guide covers crisis management and emergency protocols too. Case managers play a critical role in ensuring patient care continues smoothly during emergencies.
What kind of emergencies?
Both internal ones, like major equipment failures or sudden staffing shortages, and external ones, like natural disasters or pandemics. Their role involves rapid response, managing communication flows, and ensuring continuity of care, even if patients need to be evacuated.
And underlying all of this is quality.
Absolutely. It's all underpinned by a relentless commitment to continuous quality improvement, or CQI. Case managers are key players here.
How do they contribute?
By using established methodologies like PDSA cycles, Plan, Do, Study, Act, or principles from Lean Healthcare and Six Sigma. They contribute by collecting and analyzing data, identifying areas for improvement, and helping implement evidence-based interventions to make healthcare processes and patient outcomes better. It's that constant question, how can we do this better?
Wow, what a deep dive this has been. It's crystal clear now that the role of a medical case manager is just incredibly multifaceted. It goes so far beyond traditional clinical care.
Yeah, it really encompasses sophisticated technology, complex business operations, stringent regulatory compliance, strategic planning.
And, as we just spent a good chunk of time on, even the intricate art of managing relationships within a unionized environment.
Exactly. We've really seen how this role demands not just the core clinical expertise, but also sharp business acumen, fluency with current technology, and truly exceptional communication skills.
All while navigating this incredibly complex landscape where really every single decision seems to impact both the patient's well-being and the healthcare system's overall efficiency.
That's a good way to put it.
So hopefully you listening have gained a unique understanding now of what makes a modern medical case manager successful, especially when facing those maybe unexpected challenges, like managing in unionized settings, an area that's often overlooked but clearly critical to how healthcare operates on the ground.
And thinking about everything we've covered today, especially the rapid pace of change with technology and AI, it does leave us with a compelling thought for you, the listener.
What's that?
How will this increasing integration of AI continue to fundamentally reshape the human element of roles like case management? Where does the person fit in as the tech gets smarter?
That's a big question.
And maybe also what other essential, yet often unseen roles within healthcare are similarly complex and impactful? Roles that are quietly evolving right now to meet the demands of tomorrow. Something to think about.